Jamie, you're here with us today for your first Go program treatment.
Mm-hmm.
Can you state your full name?
Jamie Pearson.
And Jamie, what have you been diagnosed with?
Complex regional pain syndrome of my lower limb. Started with my left side, but it's spread. So.
And how did it start?
It started as I was recovering from a surgery. I had a left arthroscopic knee surgery to repair a torn meniscus and repair arthritis damage. And I was almost 100% better, and I tripped in my driveway and hyperextended my knee, and it set off the CRPS.
Okay. So how long had it been since your knee surgery that you tripped?
My knee surgery was in December of 2014. I tripped in January of 2015. I was officially diagnosed in March of 2015.
Okay. And what type of knee surgery? Laparoscopic, you said?
Arthroscopic, but yeah.
Arthroscopic, okay. And how long did it take you to get diagnosed?
It took me about 3 months. And I only got diagnosed because I started taking pictures of what my knees were doing. And when I went into my surgeon's office and was telling him, I'm like, I've got this horrific pain, nothing's happening. They initially thought I had torn a ligament in my knee, so they put me in a immobilizer brace for almost 2 months. Which I think actually probably made it worse. But I started taking pictures of my knee, started turning bright red, swelling, getting just crazy hot. I mean, it looked weird. It was tomato red color, So I started taking pictures of it, and when I went into his office, because his PA initially was one who was working with me, and he finally was like, well, I can't do anything, I can't fix it, so I'm going to have you see the surgeon again. Surgeon took one look, he looked at my MRI, said, there's nothing wrong with you. And it was about to dismiss me, and the only reason he didn't is because I grabbed my camera and I was like, or my phone, and I was like, look at these pictures, something's wrong. And that's the only reason why he diagnosed me with CRPS, is because he looked at those pictures and finally figured out. He was like, well, okay, so you're not lying to me.
Did you have any tests following that to confirm?
No, I mean, there's really not. I mean, I haven't had much. I had 5 left sympathetic nerve blocks. So, I mean, I guess those are kind of semi-diagnostic. The first one worked. I actually felt relief, and then after that, the subsequent ones never did anything. The last one, my doctor accidentally hit my sciatic nerve, so my legs went numb for half a day, and that was the end of the nerve blocks for me.
No more.
Yeah, it scared me so bad. And I think because my legs were numb, it's like I exacerbated for that whole day. So.
And so, when you said the first one worked, how long did it work?
Probably about 3 days, and then it faded away. But I immediately noticed there was I had an improved flexibility. I mean, there was an improvement there that we couldn't deny, and I think that's with my pain management doctor. I think that's what for him confirmed the CRPS, because he was still he wasn't. Didn't know much about it, and so it was.
Have you run across many doctors this far, Jamie, that are really familiar with RST?
No.
Or CRPS?
No, honestly, no. I had a rheumatologist that I saw because they did. One of my doctors did blood work on me. Saw that I had elevated ANA levels. And she sent me to a rheumatologist. The rheumatologist had very rudimentary knowledge of CRPS, and told me dismissively that, because I told her I was worried that it was spreading to my other leg, told me dismissively it does not spread, and marked me down as having severe anxiety, and that was the only reason why So that's been...
So very unfamiliar.
Yeah, very unfamiliar, and when it has been familiar, it's been older knowledge, maybe not necessarily up to date. I mean, I've done a lot of reading on my own, I think it's what most patients end up doing, so.
Yeah. Absolutely, absolutely. And so, Jamie, where are you hurting at today?
So I would say my worst part is my left knee, and then it kind of spreads down. My right knee also has issues, and then it seems like it's gotten worse for my feet than anywhere else, and my knees still bother me a lot, but my feet seem to be the most reactive, I guess. So if I'm on my feet for too long, if I'm sitting for too long, anything that seems to set them off worse. So they'll rotate between burning hot, swelling, bright red, and then alternatively they'll also go the cold route, and they'll go purple and you're almost numb and cold, and then it's like that numb pain. So
Let's go back to knee surgery. What knee was it you had surgery?
my left knee.
So the left one?
Yeah, and they did it twice because even after he diagnosed me with CRPS, he wasn't certain. So my surgeon convinced me to have a secondary surgery on that knee to verify that there was nothing else wrong. So I had surgery in December of 2014 and then again in March of 2014 on the same knee. So,
just to verify nothing was wrong.
Which nothing was, except for that my what was it? Like I think my cartilage had gotten worse over the short time between.
Any surgery on the right knee?
No, I'm not having any surgery on my right knee. I've had the corticosteroid injections in it, but that's about it.
And has the steroid injections been since you were diagnosed?
No, no, they were prior to diagnosis because I've had varying issues with my knees since I was about 13. So.
Have you been diagnosed with anything else besides CRPS, Jamie?
Arthritis. Try to think of. As far as the legs go, I think those are the two big ones. I've got arthritis. I've got what do they call it?
Chondromyalgia?
That's it. Something like that. Yeah.
Chondromyalgia?
It's like damage to the cartilage. I think is that one. Then also I have tracking issues with my patella. So it's always been. I mean. Starting when I was 13, I had my left knee go out of place, and I've had tracking issues with my knees since that time frame. So that's pretty much why I developed arthritis at the age of 31.
Do you feel
arthritis in the knees?
Mm-hmm. Yep.
And so you had problems with your knees at a young age, and then you actually ended up having surgery in 2014. How old are you, Jamie?
33.
And was that your first surgery on your knee?
That was my first surgery on my knee. Yeah.
So one to repair it, the second one to make sure nothing was wrong. 2 surgeries.
Yep.
And on the right knee, just
not really much of anything aside from steroid injections prior to, because I was also both knees show I think arthritis and
so they both hurt.
Yeah, they both do. And since the CRPS, this one also starts going red and getting swelling too. It's worse in my right foot than it is in my right knee, but I also get kind of a mirroring with my right knee.
So it is trying to mirror. And any other pain besides the legs, the knees?
I get sometimes like stiffness in my fingers. My fingers also. With Raynaud's syndrome, so I tend to have the go really cold purple even in my fingers, or they'll get hot. Mostly they go towards the cold side of things. So I get stiffness in the joints of my fingers, and then I get, probably because my posture's not exactly great, I get neck and shoulder pain, and then also I have a bit more up front that kind of also alters my posture. So.
Exactly. And so right now, anything hurting besides the knees, the legs?
Yeah, once again, probably from the flight mostly, but I've got a bit of neck pain. But and like I said, that's pretty normal for me, neck and shoulder, just because, like I said, I don't have the greatest posture, and I know that.
Well, we're going to work on that. No worries. And medications?
I'm on a pretty good list. So I've got 2 pain medications on one, so I'm on morphine sulfate, 15 milligram, so extended release, and then I have oxycodone, 15 milligram as an instant release for pain, and then I'm on Cymbalta for depression as well as pain. I think it's Cymbalta. Generic is Fluoxetine, and then I'm on another one called buspirone, which is a anti-anxiety medication that I take twice a day. And then I have Wellbutrin is another one that they have me on once a day. So a lot of antidepressants. I'm trying to think also.
Gabapentin?
No, I had I took Lyrica. They diagnosed me, or they gave me Lyrica right after they diagnosed me, and so not gabapentin, same. And it left me to the point of I could not get out of bed. I mean, it had me so sick feeling that I had to stop, because I couldn't function with it at all.
Mhm.
So I'm currently not on that. I had a prescription to amitriptyline for a little bit, and that one actually did sort of seem to help a little bit.
Is that for migraines?
It is they give it for to help with sleep, I think, and then it also does. It's got the same, or it goes for the same sort of like nerve. I've got on my phone. I've got a spreadsheet that I have all my meds on because it's
That's
just
right.
easier for me to keep it straight that way, and I didn't feel like rewriting it.
And it's okay. You don't have to list them all. We're just getting an idea.
Yeah.
So you've got several medications.
Yeah,
going on.
unfortunately, yeah. A lot of antidepressant and anxiety. Anxiety and depression weren't pre-existing prior to. They've just gotten worse since my diagnosis.
Mhm.
So I'm on a lot more. Like, prior to my diagnosis, I'd actually gone off of all my antidepressants, most of my medications actually. And since after my diagnosis, is everything my medication list is like expanded as we go along. So.
Are you able to work at all?
No, not right now. I tried for about a year. I worked, so from the time of my injury in January, I kept trying to work through till November of 2015. But I got to a point where for one day of work, I was at home having to recover for approximately 2 to 3 days. So it was like I would work and then I'd be so drained from that one day of work that I couldn't function for, a couple of days. So it kind of got to the point of I felt like I was incredibly unreliable and I could never gauge how good or bad I was feeling. So I might have one good day, but then that one good day could have been followed by a week of bad days.
Right. So Jamie, on a pain scale right now, where would you say you are? On a pain scale 1 to 10. 1 being least, 10 being most.
Probably like a 7 or an 8 on my left side. Specifically, it's seeming to be, that may have been the flight or just position, but it's tending to be the worst right now, especially my knee.
And Jamie, what are your goals for the week with us here at the Gold Program? What are you hoping to achieve this week?
Well, I'm hoping to add to additional techniques. I mean, I did physical therapy for a while, and that actually really, really helped. And so I want to add to a bit of my skill set as far as like how to cope and how to manage it, and then figure out find out if we can reduce the pain. I'm not expecting 100% anything, and even if but anything basically if I can add to my bag of tricks of how to deal with this, I'm good.
Right. Absolutely. Anything.
Yeah. Any improvement, anything I can add to it, anything to help me cope is all I'm really looking for. And
Right.
And I've heard good things. So.
Yeah. Well, hopefully all those will come true.
Yeah.
And so, Jamie, you realize that we film you before each treatment, we film you after each treatment.
Okay.
We are completely 100% transparent with everything we do with the Gold Program.
Okay.
We want you to be completely honest in your interviews,
Okay.
whether it's good or whether it's bad.
Mhm.
We put it all out there,
Okay.
and that's what we're about. Is there anything else that we should know, or anything else? How well do you sleep at night?
It varies. Most of the time I have a lot of trouble falling asleep. And then sometimes it's staying asleep. Sometimes I can sleep an entire day away though. So it's all dependent on my energy levels.
Okay.
So it's like, it goes up and down. I think I wear myself out to the point where I have to, where my body just gives up and I have to sleep. But,
Like last night, how well did you sleep?
Not awesome, but in a new location too. I've always had problems with that. So.
Okay. Well, we're going to track your progress each and every day, twice a day.
Okay.
We're going to be here with you, and that's it. We'll just talk to you after your
Okay.
first treatment.
Okay.
Thank you.
Yeah.